Despite the uncertainty about the health of Ugandans in the face of COVID-19, many people are losing a source of livelihood, financial stability, and hope due to measures taken by government in the partial lockdown. Makerere University Associate Professor Winstons Muhwezi, also a specialist in psychiatry and behavioral sciences, says the situation needs no panic.
But because of, like a pressure cooker and things are boiling up and the husband and the wife are at home every day looking at one another, there is no money, children are sick, and you get breakup of relationships and domestic violence and all this. So yeah, there are serious implications that are associated with this situation. But in the circumstances, what is happening is what had to be done. I don't think the president happily announced a lockdown. This is the only way to deal with this disease.
But this situation has been worsened by people who focus on negatives.
Exercise more, as the president taught us. I am doing my aerobics in my sitting room on very nice Christian music. If you have a compound that's sizable, run around. Protect the children from regurgitating these negative images that in a way can propagate negative energy.
For us, Muhwezi appreciates how Uganda has managed the COVID-19 pandemic. It's too early to celebrate the achievements if personal behavior change fails. So far, out of the 56 COVID-19 confirmed cases in Uganda, 38 COVID-19 recovered patients have been discharged from hospitals, leaving 18 active cases. Currently, the number of people that have been discharged are more than the active cases that we are having. Should we have confidence that our government will come to the top of this disease in the quickest time possible?
I'm not going to clap hands and say we are out of this already. It's good the government intervened and intervened at a time it did. That was very good. But for me, I think it's on us. We don't know what's happening in the community. So I think we are still sitting on tenterhooks here. We are sitting on glass. We should not celebrate too early. We should maintain the discipline. We should maintain following the guidelines. Let's watch the space. Let's be careful. Otherwise, you can have a premature celebration.
Preventive measures like regular hand washing and sanitizing will also help Ugandans to avoid infectious diseases.
Existential threats force social cultural change. And that this is something that's threatening our existence. We should prepare as we transition into this period of the lockdown, or even later on when we get release of this lockdown in a measured way, that people should learn to live in the new norm. There are certain things that will change in our social cultural setting. Many people, here there has always been problems of diarrheal diseases, and one of the reasons, people don't wash their hands after the hygiene. So maybe this will become a new norm. Maybe we shall see diarrheal diseases getting down. Now, for us in Bachiga Wanyankwere, we hug. Maybe we may have to drop that and greet in a different way.
COVID-19, first reported in Wuhan, China, in December last year, has killed at least 171,843 people worldwide, with at least 2,505,367 infections. According to Worldometer's count on Tuesday, over 659,614 people have recovered globally. Bernard Yiga, UBC.
Cover your mouth.